Hi, I'm Carla Schimmelfinnig, registered physical therapist from InjuryGuru.com. Have you been having some wrist pain, maybe even some swelling in that wrist or into your hand? Wrist pain can be so limiting just because we need our wrist and hands to do almost everything we do throughout a normal day. So stay tuned for an exercise program that I want to show you that I've used with my patients for many years, and get on your way to having less pain and getting back to those things that we need to do every day. If you've been having wrist pain and swelling, and it's pain that is a nagging or aching, dull pain that's there most of the day, maybe it even keeps you up at night. You may have sharp pain with certain movements, so grasping or grabbing onto something and then lifting. Then stay tuned, because this is the exercise program that you most likely need. If you've been having pain with just the normal things throughout the day, from getting up and getting dressed to fixing your hair, getting ready, to fixing a meal, and then grabbing or grasping onto certain objects throughout the day, pushing and pulling and lifting, then indeed stay tuned, because you need this exercise program. I want you to use some ice. You can put ice in a baggie, just some chopped up ice, directly on that wrist if you've been having swelling in that wrist or hand. Ice is very, very useful, and I want you to do that up to 15 minutes, 3 to 4 times a day. This initial exercise program for the wrist doesn't involve any outside equipment or weight, so you can do these exercises literally anywhere at any time. I'm going to ask you to do lots of repetitions several times a day, but that's just what the wrist needs at this point. In this initial phase, it needs lots of good movement, so we can increase the blood flow, get those muscles to remember what they're supposed to do, and just get you on your way to feeling better and decreasing some pain. I'm going to show you some stretches that are also included in this program that my patients have just found really helpful while they're going through this process. You're going to find that my programs are not one magical exercise or one magical stretch, but that it just seldom works that way. So I'm going to show you specific exercises in specific directions with repetitions and frequency that those joints need. I don't want you to do these exercises if they increase your typical pain. I always want you to make sure that you're exercising within your specific tolerance to an exercise. If you're having numbness or tingling, or maybe you're even dropping things, that actually can signal a more serious problem. So if that's the case, I want you to call your doctor and give your doctor the opportunity to evaluate the situation and see if there is not something more involved than just simply wrist pain. So get ready and stay tuned for the first exercise in this wrist exercise program number 1. I want you to commit to doing this exercise program for 2 to 4 weeks in order to see if it can decrease your pain and get you back to doing those things that you need to do. You need that much or that amount of time in order to see if it's going to work for you. So get ready and stay tuned for the first exercise in this exercise wrist program number 1. The first exercise in the wrist exercise program number 1 is called wrist extension. Remember, I don't care what you call it, just as long as it looks like what I'm doing. And you can sit like I am, or you can just rest your arm on a table or a desk. You just need to make sure that your wrist is free to move in all the directions I need it to move. So if you put your hand or your arm on a table, it needs to be toward the edge of the table, again, so that your wrist can move freely. I like to just have my patients do these exercises sitting. I have them usually cross their legs or even put a pillow on their lap. I want you to put your good arm across your leg or that pillow, and then place your painful side on top of that so that your wrist can move freely like mine is. So wrist extension is, again, the name of this first exercise. And it is simply, I want you to have your palm facing down, and you're just going to bring your hand and fingers up toward you or up towards your face. That's all it is. That's as simple as it is. When you do this exercise, I want you to do 3 sets of 15 to 25 repetitions, and I want you to do that 3 to 4 times a day. So remember, I said that I was going to ask you to do lots of repetitions and several times a day. And again, that's just what the wrist and muscle and the joints need at this point. You can rest 10 to 20 seconds in between each set. But remember, you're not using any weight. To do 3 sets of 15 to 25 repetitions, even with a 10 to 20 second rest in between, is only going to take you a couple minutes for each exercise. So you should be able to get the exercise program done fairly quickly. So remember, I would like you to commit to 2 to 4 weeks to do this exercise program. Give it a shot, give it a try, and see if it starts decreasing your pain and gets you back to what you need to do. If you try this exercise program for a good 4 weeks and you do it the way I've recommended and you have little to no change in your pain, then I want you to call your doctor, because it just means that you need more intervention. Your body's telling you that doing an exercise program at this point is just not going to be enough. And you may need to see a physical therapist who can actually get their hands on that joint and do an even better work for that wrist joint. So just make sure you do contact your doctor if you find little to no change in your pain.